Hi, this video is designed to give you a quick overview of the cause, symptoms and treatment for gastroenteritis. Gastroenteritis is commonly referred to by its shortened name, gastro. It is a highly contagious infection of the digestive system. It can be caused by a variety of different viruses, bacteria and parasites, as seen on the slide. This illness is highly contagious and can cause outbreaks in large public areas, such as schools, cruise ships, restaurants and hospitals, as they are easily spread by touching surfaces, eating food or consuming particles in the air that are contaminated with the virus. Bacterial gastroenteritis arises from the consumption of contaminated food and raw or undercooked meat, particularly poultry. The parasites associated with the stomach flu must enter via the mouth and so are also caused by consuming food or drink contaminated with the parasite. Gastroenteritis has symptoms which are common throughout all strains of the disease. These are nausea, diarrhea, vomiting and abdominal cramps. Vomiting is more common in children, while diarrhea or loose stools is more prominent in adults. Depending on which strand of gastroenteritis was contracted, the symptoms may show up within 1 to 3 days and may last up to 10 days. Whilst gastro is relatively harmless, it is advised to see a doctor if you are dehydrated and unable to keep liquids down, have seen blood in your vomit or stool, and have a fever exceeding 40 degrees. Worldwide, diarrheal diseases are second only to cardiovascular diseases as a cause of death, and are the leading cause of childhood death. Severe gastro left untreated in children is potentially deadly. The pathogen norovirus can be attributed significantly to acute gastro. This is a general observation across all age groups. It has been found that norovirus relates to 18% of cases involving acute gastroenteritis. Rotavirus is one of the most common causes of acute gastroenteritis in children between 5 and below. The World Health Organization has concluded that 527,000 deaths are due to rotavirus. It was also noted that more than 85% of deaths occurring in developing countries such as Africa and Asia are as a result of poor personal hygiene and unfiltered water. In most cases, gastroenteritis needs little to no treatment, as symptoms disappear within a few days of bed rest and regular fluid intake. The patient may experience vomiting, fever, diarrhea, nausea, stomach cramps, and pain for approximately 1 to 3 days. If this period is prolonged, you should seek medical attention. Treatment for gastroenteritis can vary depending on the cause and the severity of the illness. In severe cases, a patient, particularly young children and the elderly, should seek medical attention immediately, as dehydration is a serious complication and can be potentially fatal. If admitted to hospital, a patient will likely be treated with intravenous rehydration therapy, or IVT. Whilst it has been found that IVT has no clinically important differences when compared to oral rehydration therapy, ORT, it is useful in treating patients who are too ill to consume through ORT. As an Australian citizen, public hospital visits are free when a Medicare card is presented. However, Medicare does not cover emergency services such as ambulances, which can vary in price from $467 to $949. To treat mild cases of gastro, it is recommended to drink plenty of fluids, drinking small amounts regularly. Rehydrating drinks are also recommended to help keep electrolyte levels up whilst experiencing dehydration. Anti-nausea tablets have been found to help alleviate symptoms of gastroenteritis in both children and adolescents. It has been found that an oral dose of anti-nausea tablets helps to control episodes of vomiting and avoid hospitalisation and the need for IVT. Your local GP should be the first health professional you seek help from if you are experiencing severe symptoms. The doctor may prescribe you anti-nausea medication, which can be collected from your pharmacist. If in the instance of severe gastro, your GP may refer you on to a gastroenterologist, who specialises in issues surrounding the digestive system. If you or someone you know is experiencing gastro, remember to keep hydrated, and if symptoms persist longer than 3 days, seek medical attention. Thank you for listening.